Before the break, I told you about the racist history behind anti-abortion efforts targeting the black community. For more on this, I'm joined by Janice Fountain, Executive Director of the Yellowhammer Fund. She's also a founder of Margins, Women Helping Black Women, a community aid organization that addresses the needs of low-income black mothers. Michelle Goodwin is a professor of constitutional law and global health policy at Georgetown Law School, host of the podcast On the Issues with Michelle Goodwin, and author of the award-winning book, Policing the Womb, Invisible Women and the Criminalization of Motherhood. Good morning to both of you. Thank you for being with us. Janice, you and I have not had a chance to see each other in person for some time, but as soon as Roe fell, you were my first stop. I went to Alabama. We talked about some of the things that women were going to face, and you pointed out that women across Alabama and across the Southeast were going to face these problems, but black women were going to face them yet more harshly. Tell me about how these restrictions have exacerbated the challenges that black women in the South were already facing.
First, Moshe, I really want to thank you for your coverage of this. And I have to apologize. I'm still very emotional about all this happening. But when I joined you in Tuscaloosa, I remember saying that black women would die, right, from this abortion ban. It was a death threat. And so many people told me that was hyperbolic, that I was exaggerating. And now here we are with Amber Thurman and Candy Miller being casualties of this country's attack on reproductive health care. And they're not just inconvenienced, they're dead, right? They're not coming back. There's not going to be a policy change that means that they get to take care of their children, they're gone. And we named this, right? We said this would happen. And so it's just infuriating for people to still have these conversations about abortion bans as if they aren't violence, as if they aren't killing people. And black women shouldn't be the collateral for people's political campaigns. And fighting this has been such an uphill battle because there's that, we have to be civically engaged, right? But we have to organize now. Like, not all of us are going to make it to see those policy wins. So what does it look like to care for people now in this moment where we're having to watch black women die and be collateral for political agendas?
Yeah, you did name it. You were very, very clear about how this is going to unfold. Michelle, let's talk about why it's especially dangerous for women of color to have abortion access isolated and removed from the umbrella of health, reproductive health, and maternal health, all of which suffer in this country in a way that they do not in most developed countries.
Such a long legacy of the targeting of black women and utilizing their bodies in the most horrific ways. We know this, it's written in stone in terms of the history of our country, a disregard for the lives, the well-being, the health, the safety of black women from time of slavery through Jim Crow. We see it now. There was a book called Unequal Treatment. The Institute of Medicine published this over 20 years ago. And they chronicled virtually every area of healthcare. And it turned out in every area of healthcare in the United States, black people had it worse. And the only area where black people got more service than white people did was with amputation. Black people were 2 to 6 times more likely to have their limbs amputated, the only area. And when we think about matters of reproductive health and safety, my goodness, what black women have been targeted with. In the 1960s, when black women demanded inclusion in welfare programs and Medicare, Medicaid, that's when we get the Mississippi appendectomy, the coercive sterilization of black women because they wanted equality. Fannie Lou Hamer told us about that. The Supreme Court itself has acknowledged that an abortion is far safer than carrying a pregnancy to term. You know, just a few years ago in a Supreme Court case, Whole Woman's Health v. Hellerstedt, Justice Breyer, in writing that opinion, said that you're 14 times more likely to die carrying a pregnancy to term in the United States than having an abortion. Abortions are incredibly safe. And when you look at the risks that are involved, if these were men, the government would say, save your lives, do that, which is 14 times more likely to save your life, and we will fund it. We will underwrite it rather than the risk of you dying. But when it comes to women, there is that disregard. And then it becomes even heavier, like concrete tied around the ankles for women of color and especially black women in communities where there's just been historic mistreatment in the medical community. I mean, if we're honest about it, Allie, then we know that there are Black people in the 1940s, 50s, and 60s that were dying on the steps of hospitals that refused to admit them. Segregation within hospitals, and there's still suspicion about Black folks. And let me just add one thing that I think will bring it home for your listeners and viewers. At the University of Virginia, they did a study within the last decade of medical students and residents to see whether or not they had these same beliefs that people had 50 years ago. And it turned out they did. You know, that they believed that Black people had thicker skin density, that they don't feel pain, that they have a different kind of blood, that their blood coagulates differently. So, Allie, that's where we are.
These myths persist, and you make an interesting point, Michelle, that when it suited people, Black women are being sterilized. When it suits people's political agenda, then Janice, for Black people to have an abortion is Black genocide. And in fact, this Black genocide thing is having a bit of a revival. I'm hoping your answer is no, but do you hear people using this argument?
Oh, absolutely. When we would transport folks to the Atlanta abortion clinic, that's all you heard in the background was, well, I guess Black lives don't matter. Well, y'all are killing all the Black people. It's not us. So absolutely, there's definitely a resurgence of that. What's difficult is that there are conversations that have to be had around how we offer abortion and how we talk about reproductive autonomy, but that's not it, right? That conversation is being weaponized in an intentional way against us and not as support of bodily autonomy at all.
One of the things you pointed out to me, Janice, when we were in Tuscaloosa, is that for one of the inherent structural pieces of racism that is only multiplied by this is the lesser access, the lower access to health care or health insurance that Black women in places like Alabama have. So they're starting from a net negative place in the first place. And then if they require added protections or added reproductive health services, they're not available to them anyway, but they weren't getting them in the first place.
Oh, absolutely. And I think one of the things that people don't talk about enough in terms of access or in terms of what abortion bans mean for Black women is that we're largely relying on state clinics, state medical care, which is obviously incredibly biased. It's not that we're talking to primary care physicians that trust what we're communicating to them. It's that we're having to take whatever we can, and that's a risk. And a lot of people don't know where they can go to actually have conversations with their providers that actually care about their well-being. Not everyone knows that Dr. Yashika Robinson has a birthing center and that she's pro-abortion, right, where they can have a candid conversation about their choices, or Heather Gaines. And a lot of people are just scared. So it's either that they don't seek that medical care at all, or they don't know how to have the conversations with someone that is biased in that way.
Michelle, what's your sense of this Black genocide conversation and its historical context?
Well, you know, it's the big lie that's been portrayed by the Supreme Court. And this is where we should be very, very cynical and skeptical about the court itself, because genocide, as Justice Thomas should know, who's been a perpetrator of this mythology, 1927, the Buck v. Bell decision is where the United States Supreme Court permits eugenics policies to go in place. And we know explicitly it's not a case about Black women. We know it's not a case about Black women and abortion. It is a case where Justice Oliver Wendell Holmes says Carrie Buck is a poor white girl. And the reality, and it's a Project 2025 reality, and people should know this, in the United States at the turn of the century, there was a real question about what to do with poor white people. And we are a country that in 1927, our Supreme Court said it was okay to coercively and forcibly sterilize poor white people. Justice Holmes said, better than to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind. Manifestly unfit, it was considered white people. The state of Virginia was rounding up poor white people, little girls, 10, 11, 12 years old, and sterilizing them. The idea was America had no room, no space for poor white people. And Justice Holmes said 3 generations of imbeciles are enough. And the subject of that litigation was a poor white girl who had been raped at 16 and had a baby out of wedlock. So this mythology is a made-up thing. And what makes it so horrific is that this is a Supreme Court case. Our Supreme Court justices should know the law and should know this case and its origin. And so there has been a way, again, of utilizing Black people, Black women in this space of mythology, stereotype, and stigma.
Thank you both for shedding light on this for me and for our audience who may not have known some of these stories. And thank you both for being here so much for us to tell this story. Janice Fountain is the executive director of the Yellowhammer Fund and founder of Margins, Women Helping Black Women. Michelle Goodwin is a professor of constitutional law and global health policy at Georgetown Law and the award-winning author of the important book, Policing the Womb. We'll be right back.